your email?
Cervical instability.
Cervical. And I mean, I think you mentioned that it's the same thing. It stems from an accident and that sort of thing, right?
Yeah. Basically, they said all the stuff like my head pressure, balance problems, digestive issues, everything. Even some of the patients are saying they can't eat oil. They can't, like, it's exactly identical.
Wow. Wow. So that's good. I think that if we kind of like roll the clock back, I think that we went down the correct road, but
Yeah.
It takes time to figure out what's going on, right?
Yeah.
So that's amazing that we found that you found that. That's good. Of course, the challenge will then be, what do you do about it, right?
Yeah, now it's about finding the solution, and this is where we came to. I did those tests that I attached to, is because the place that does the treatment, prolotherapy, it's called. This is like only 3 places in America that has this therapy, and this one I applied to all 3, and they got back and told me to take these tests.
Now, I see. Okay. Huh. Well, pretty crazy. I'm just kind of reading around a little bit here. Okay, so question for you. So I think it's good that we know what's going on now. How did you, like, what have other people said about the treatments, about the prolotherapy? Like, is that like the standard treatment for that? I can't imagine it would be if there's only 3 places that are doing it.
Yeah,
Right?
that's where this is the next challenge, right? The great thing is, okay, 9 years I found my problem, but now I'm looking at the treatment, and this is the standard, meaning like there's no cure other than this stuff. Like there's nobody who does anything with this.
Interesting.
Yeah, it's just basically like there's a couple things, like couple of tiers. I've been just researching and going through these Facebook groups. And first is prolotherapy, which is basically the idea is that I broke a piece of my neck that's right next to my brainstem, and there's no blood flow or much movement there, so the body never goes to fix that part. So what prolotherapy does is that it injects like sugar, dextrose, and just some
Yeah.
things like that, and it creates like a, hey body, pay attention, go fix this thing, and then hopefully that can like do certain things and get some kind of benefit. Now,
Yeah, then you'll get some traction from there, and
exactly. Now here's the thing: a lot of people don't have much benefit from that, and from the people I'm talking about, it looks like it's about 50-50, like maybe even a little worse.
yeah,
And then if that's the case, then they do a different type, which is they take your blood, they spin it in a centrifuge,
yeah.
and they get the plasma-rich part of the blood, and then they inject that part. And apparently that's like a stronger version. So these are the 2 things that I've come across with so far.
Okay. And both of those things, they make sense to me in terms of what they do. Just having a look here at what prolotherapy is, for treating chronic pain around joints and ligaments, the body basically stimulates the repair. Okay. Now, have you done any MRI scans or anything like that of this area ever?
Yeah, we did a lot of MRIs of head and neck. Nothing ever came up. Everything's normal. That's why I'm getting a digital motion X-ray, which is tomorrow. This is another MRI type that's like you have to go it's like while moving and laying down and while flexing and extension, and that's what they recommended that can catch this. Now, let's see how it goes. So there's only one machine in Arizona that can do this, and this person said that nobody ever comes to him, so they put the machine away. So they're taking it out for me, and
Wow.
to do this. So
Man, it's so insane, right? It's crazy, man. But you know what? Like this is, thinking outside the box, and I think it's great that you've taken this on yourself, because that's what it's about, right? Well, yeah. Once you start getting into these rare and complicated things, there's very few people that
Right.
really know what to do, right? Because they're so rare.
Yeah.
But all of this is sounding very, very positive. The reason why I asked about the scan and all that sort of stuff is I would be interested to know, or I think it would be maybe useful for you to ask them to see if like a piece of bone chipped off or something like that, and it's there, or if you still have a piece of bone that's like, if it's pushing on a nerve or it's blocking something. Is that what's going on, first of all, right? Because if that's the case, then is there a possibility to surgically remove that piece? You know what I mean? Like if you have like a minor fracture or a minor break or something like that in any bone, it's sometimes what will happen is a piece of bone will actually chip right off.
Right.
So it's not like a full break in that sense. It's just a piece that chips off. And you might not even know that it's doing anything, right? Like plenty of people have chipped bones and it just kind of breaks off and then it just hangs out. But if that's happening here in such a small, tight space, that could actually be causing a lot of problems for you, you know?
Exactly. So I've been like talking to a bunch of people that have this, and basically I have some little bit of data. I'm collecting more, but basically it's like if it's the lower part of the neck and something chipped off, it's things to do with like arms going numb, legs going numb, and some parts of your face going numb and getting droopy. I don't have those. What I'm more relating to is upper part of my neck right next to the brainstem, which is the C1, C2, which has 100% match with my symptoms.
Yeah. Okay.
And what the guy said from the Florida place, Caring Medical, that I'm trying to get a prolotherapy from, they have some videos where they explain that if you have this part, then basically what's happening is like the neck has the bones, and then if one of them are like tilted this way after the accident, it's poking the vagus nerve, and that's what's causing a lot of this. So we were in the right direction with the vagus nerve. That seems like a very core part.
And I think also what's interesting for me is just, that was why my first thing was like, let's find a functional neurologist and a chiropractor, someone who can actually assess that properly. But maybe they missed it, or maybe they just don't have the know-how to assess it that finely. Do you know what I mean? Because it's like, I don't know. I'm not a chiropractor. I don't know if you feel someone's neck, can you feel a difference from a normal person to someone like you, or is it like deeper into the brainstem where you're not even going to notice any difference?
I think this one is like deeper. It seems like it's just like a little twisted right in the part where the neck bone becomes the brain, because it's like inserts in from what it looks like. That's where the break happened. Wow. So it's very hard. But the sign was that when I went to the chiropractor, he did some vagus nerve stimulation and stuff, and within 3 weeks my jaw clenching went down. So I never had anything done ever that was like immediate, it was always like, I think something is improving. It's very slight, right? Like, okay, I can walk a little bit more, or maybe like, oh yeah, I look like I have a little less head pressure. But this was like something pretty direct. Like he did something and my jaw clenching stopped. That should have been the first sign that like, okay, the vagus nerve is like critical here.
Well, and that's why we spoke about that. Like, that was in, I think, the intake session. It was like car accident, and then everything happened after that. Like, what happened at the car accident? And if it's happening here, well, then vagus nerve, that ties into all of your internal organs.
Exactly.
And that's where the digestion piece, I think, comes in. As for the rest, again, that's not an area that I specialize in terms of the other symptoms that you have. But,
the guys said, like, some of the testimonials, they were just like, like, once they're able to get this part like kind of on the back on the way, they could eat food again, and their pressure went down, and their hands and feet, the joint pain went down. They had other symptoms, but then just from that, I'm thinking like, if I can eat and I can use a computer, it's like, that's Like I'll be completely fine.
Right now, you're trying to survive. And
Yeah.
You're trying to move in the right direction. Like that's where you're at right now. So, so that's great. You know, it's all. I mean, I think this is a major leap forward in terms of where we've come from. You know, even before you started working with me, like this is a big leap forward. So.
Yeah, no, this is, and it's like good thing. I mean, it came at a point where I was really starting to question, like, you know, like I wrote my will and stuff. Like, you know, it was like I was really starting to like think like, okay, you know, 3 nights in a row, I'm almost like, you know, like suffocating and I can't breathe, and you know, I know if I go to the ER, people will say.
I'm curious in what you researched. Like, I'm just wondering to myself, like something like that, I could see how it would cause something and then stop. But I don't know how would it get progressively worse? You know what I mean? Because that's kind of what happened, right? Like, I mean, how did it get worse and worse and worse? I wonder what else was going on. You know?
I mean, it seems like everybody says like it seems like it's pretty common within this because the people I'm talking to, like, nobody's like 5 years even. Average I'm talking to is like 10, 15 years to find the root cause, and they kept on getting worse and worse and worse in a kind of similar way as me. Some of them are way worse actually. Some of them are to a point where they can't move, like they're literally bedbound. And it's the same thing. They got rear-ended. That's the most common cause. That's like the most common cause. Like they just got rear-ended at a traffic light.
Wow. You know, yeah, and that's just, it's why it's so important, you know, to look at people's health history, you know?
Yeah.
It's so important because if you didn't, I mean, can you imagine? We just never even addressed that on a timeline.
Right.
Never.
Yeah.
Taking digestive enzymes, taking all kinds of other stuff, you know, to try and fix a problem that ultimately got like this one root cause that's affecting every single part of your body, which is crazy. So.
Yeah.
Good. I mean, hey, you know, I know that you're still not in the great. So just so you know what we're actually looking at, first of all, is probably a good. Give me a second, sorry, man. Let's pull this back onto here. I can't draw on my monitor. It doesn't work like that. Okay, here we go. Cool. So you can see that?
Yeah.
Okay, perfect. So, first of all, just so you know what they're actually looking for, first of all, right? Now, I'm also curious here, just before I get into this, the lab has requested that you get this before they will accept you as a patient, or what?
Yeah, correct.
Do they have certain criteria that needs to be met in order for them to consider you as a patient?
Their number one thing is DMX. If I can get a digital motion X-ray and it shows that my neck is broken, then that qualifies and overrides everything else. But
now, why? I'm just curious as to why they are, why they would reject you otherwise, even though you've got all of the symptoms. Like, are they busy with this, or are they just?
They're booked out till August.
Say again.
They're booked out till August.
Yes, so they're busy.
Yeah, they're pretty busy because there's only 3 places that does it in America. So I'm guessing everybody who knows about it can go to these places. I'm trying to qualify as an emergency. I want to let them know that, you know, like I'm kind of suffocating at night and I feel like I'll die, like, so they can maybe make an exception.
Okay.
But at the same time, like, I'm just balancing it because I mean, I'll bring this up at the end of our call a little bit because the thing I'm having trouble with right now is just trying to see like who is the best out of these 3, because I'm getting mixed results, like, and mixed data. They have some parts on their website that says like 98% of the people that come through is good, but then I spoke to at least 30 people, like literally all of Saturday. I was just like all day just happy sitting, and my girlfriend was just next to me and messaging everybody we could find on Facebook about this to have a discussion. And we found at least 4 or 5 people who said that they didn't have a good experience, and some said that they kind of got a little bit worse, which is kind of scaring me. So that's the part I'm trying to balance right now. But before we get into that, we can just, this is kind of where we're at. They said, hey, go get these tests. We want to look at it to see if you qualify.
Okay. What I'm going to do is I'm actually going to record this quickly so that I can send it to you afterwards, just so that you just so that you have it, because you might forget. Okay?
For sure.
Let me just do this.
This meeting is being recorded.
Okay. So first of all, as you know, I'm not a medical doctor, so I can only tell you what I can tell you here. I understand what the tests mean, but legally, I'm not actually allowed to interpret these, right?
Right.
When you look at, first of all, when they're looking at ANA, right? So ANA is anti-nuclear antibody. Basically, what this is looking for, what most of this lab test is actually looking for, is they're looking for, are you suffering from an autoimmune condition? Okay. Do you know what autoimmune disease is, first of all?
Yeah.
Okay. Simply put, an autoimmune disease is where auto meaning self, immune, right? So your immune system is attacking certain tissues in your body, right? So you can have, there's 120 different autoimmune issues, and this particular, like an ANA screen, is not specific to any one autoimmune disease, if that makes sense. It's a very general marker.
Okay.
So like this is abnormal over here, but I don't know from abnormal, the test doesn't really show me how abnormal it is. One, it doesn't show me anything specific, like are we dealing with lupus, or are we dealing with celiac disease, or is it like, what is it, right? So it doesn't tell us that, but it is abnormal, so it is out of range. You will see here that the titer, so this is getting a little bit more into actually measuring the levels, right? And you can see that they're high. What I will say, though, is when you look at a titer of 1 to 180, you will notice that if you look at the ranges here, can you see it's on the cusp?
Yep.
It's right on the cusp. So most doctors wouldn't diagnose you positive at this point, right? Because there's plenty of people that will have this value here, even though they're healthy with no symptoms.
Got it.
So it's very much borderline, right? What I would do is I would actually, and the same thing here, right? So if you can see, this is abnormal, right? Is the pattern. These here are usually normal. And then the nuclear part, I think, is the part that's a little bit out of, that's the abnormal part, right? But you can see here, dense fine speckled patterning, it's just the way that the test is done, is seen in normal individuals, right? And rarely associated with things like lupus, Sjogren's syndrome, and sclerosis, and what have you. There are actually some other illnesses as well that I was looking into based on this pattern. I'm not going to reshare my window right now because the recording is going to get all screwed up. But there are some other things as well that kind of fit into this pattern. But I think, generally speaking, I think that from an autoimmune perspective, you are very, very much on the cusp. Okay. All right. So most people would maybe not diagnose you as positive. However, because you've got 3 abnormal markers, the next thing that, if you really wanted to dig into the autoimmune side of things, would actually be to run a very specific panel that would detect which type of autoimmune disease that you have.
Right. Makes sense.
Okay, and that's where the lab that does, as far as I know, that does the most broad spectrum one is a lab called CYREX, and that's CYREX, and they have a very, very broad spectrum autoimmune diagnostic panel from there, and that's how you would proceed down the road for all of that. To your other things here that you measured, you can see that the sedimentation rate is normal, right? So there's nothing to report there. You'll actually see, which I was a little bit surprised at, is your C-reactive protein. Now, this is not what's called high sensitivity C-reactive protein. It's not HS, but nonetheless, your C-reactive protein it's a marker for systemic inflammation.
Okay.
Okay. So in other words, the higher your CRP levels, the more inflammation you have in your body.
Okay.
Okay. Again, it doesn't tell me where that inflammation is located. It's non-specific. It just says you have lots of inflammation, right? And the reason why they run that together with these autoimmune markers is one of the hallmarks of a lot of, pretty much all autoimmune disease is inflammation. Okay. So you'll see that people with autoimmune disease have lots of inflammation, and then you can kind of use that. There's some other markers as well, depending on what type of autoimmune issue you have, that you can use those to then kind of gauge how severe things are, but then also to gauge how the treatment is working, right? So you would see it come down. So for you, with the level of 1.2, which is where you're at, if you can see the range here is 8. Yeah, basically you want to be below 8. So you're well within that range. So I think that based on our conversation that we just had, I think that a lot of the issues that you're experiencing are not necessarily inflammation related per se. I think a lot of it is nervous system related.
Yeah, I was actually even kind of thinking down that line over this weekend itself. Like, I was thinking like I probably don't even have an actual autoimmune disease. I just have a lot of these kind of things that are mimicking an autoimmune, like I have a dysfunctional autoimmune, immune system because of my neck, pretty much.
Right.
That's what I'm thinking.
Yeah, and I would tend to agree with that again because we can see that everything is really on the cusp here. I'm just gonna stop. Let me just do a new share here. See if I can get back onto that. Give me one second here.
Sure.
So I just want to show you. Here, so this is the one that I wanted to show you quick. Okay, it's still recording, so it's good. So this is actually from Quest Diagnostics. I don't know that this is the exact same test you did, but you can see though that you've got ANA titers and patterns, right?
Right.
Okay, so the point is, you can see this is the same range that we saw on that test, low and 180, 1 to 80 and up is considered positive. But here's the things that it's associated with, right? So ANA antibodies are associated with rheumatic diseases, including systemic lupus, mixed connective tissue disease, Sjögren's syndrome, scleroderma, polymyositis, which I actually thought you might have had, to be honest. That was one thing I was looking at. Crest syndrome, and then neurologic lupus, right? I went and looked at some of these, and the only box that I thought you fit into was really polymyositis, but then now we're talking like I don't think so. You know what I mean?
Right.
So my point in saying all of that is, I think I agree with your interpretation of things. I think that a lot of that is just stemming from what's going on here with the neck injury and however that's affecting the nervous system. Okay.
Right.
Yeah, based on your results, I would say again, like everything is very borderline, but I wouldn't necessarily go down the autoimmune path just yet.
Right.
Because the truth be told is a lot of the stuff that you've done, even like just think about it from a dietary perspective, right? You literally ate salmon and sweet potato for how long?
Over a year.
So one of the main triggers for inflammation and for a lot of autoimmune stuff is going to be dietary triggers.
Right.
So you didn't just do paleo, you like went to a whole nother level, right?
Yeah.
So I think that's why your inflammation is probably quite low. You don't have a lot of things coming into your body that are going to be triggering that inflammation. So your actual overall body load in terms of dietary triggers, we did do the mold though. We did that mold testing in your home.
Yeah.
So I think that might be feeding into it a little bit, but now that we know what we know, I think that you're definitely on the right track. Okay.
For sure. Okay, right. So yeah.
I'm gonna just stop the recording for you. I'll stop the recording so that you can review this again if you want, and then we can carry on chatting. You can see a bird's eye view, but what's interesting is when you look at this here is as the central piece. You've got this compression, which leads to vagus nerve, which then leads to things like mast cell activation, GI issues, systemic inflammation, which you don't have, autoimmune, which is borderline, but this is actually causing the autoimmune piece, whereas, it's not the autoimmune disease that's causing your symptoms, if that makes sense.
Yeah, this is the root cause that broke my immune.
The root cause is causing the symptoms, and one of those symptoms could be autoimmune disease.
Right.
Right. And now the other thing, which is very interesting, because I thought about this when you were, that they're going to be tilting you and all sorts of stuff on that test.
Yeah.
There's another diagnostic thing that you might want to pay attention to, which is called POTS syndrome.
Yeah.
POTS.
The chiropractor tested me for that.
He did. Okay.
Yeah. He said
and
no.
negative.
Yeah.
Okay. So.
He said very slightly. He's like very slightly. You wouldn't be considered POTS. That's what he said exactly.
Yeah. And then, all of the stuff down here, chronic fatigue, foggy brain, headaches. Crazy, man.
Yeah.
Brainstem compression. So I think, you fit into a lot of these boxes, eh?
Yeah.